Welcome to this podcast from MD Briefcase, presenting knowledge and insights from key opinion leaders in medicine. Our independently produced podcasts are especially designed to support your practice. We hope you find it useful and informative.
Welcome to today's podcast where we're going to be exploring hepatitis C and stigma. I'm Dr. Annie Borkham. I'm a GP based in the Central West who's worked in the field of viral hepatitis for many years. And we're in Australia trying to, meet that WHO goal of elimination of hepatitis C by 2030. But, we've treated about half of the people who are living with hepatitis C, but we still have another, over 120,000 people who haven't either gone through treatment or don't even know they're living with hepatitis C. We're just privileged today to have with us Belinda, who is someone who has lived with hepatitis C. So welcome, Belinda. I look forward to having a chat. Can you just tell me a little bit about your sort of journey with hepatitis C?
Sure. I first contracted hepatitis C at about the age of 19. Back then, that was 1993. We didn't know a lot. Well, it was still fairly untreatable, exceptionally untreatable at that stage. And not a lot was known about how you caught it, what was the risk factors, how long it lived outside the body, all of that sort of stuff. So I contracted it and just sort of thought, okay, this is what I have to live with now, It wasn't until the new treatments, the very new one, actually a partner that I had went through the interferon treatment and I supported that person while they went through it for the 6 months. And the effect on them was so significant that me as the main breadwinner didn't think that it was anywhere within my abilities to go through that and continue to work. It was very chemotherapy-like treatment, vomiting, hair loss, memory loss, headaches, skin rashes, you name it. So it was daunting. And I thought, no, there's no way I can do that and still keep working. So I shelved that idea for many years. The new treatments came out and, things got a little bit brighter. But that was 27 years on or 20, something like that from when I first contracted it.
And I know some people said that when they first got it in the 1990s, they were basically, like when they were diagnosed in 1990 or before, they were basically told, oh, you might have 5 years to live. Like that was the level of sort of, as you say, that description of the lack of knowledge. But do you think that people who with hepatitis C experience stigma from healthcare professionals?
Oh, absolutely. Healthcare professionals are part of the wider population, and the wider population holds stigma towards this particular illness. And I guess it's because it's connected to a activity that is illegal. Yeah. And therefore the stigma follows the fear or the unsavoriness around the fact that it's illegal to inject drugs. And that's how I caught it.
Yeah, no, I agree entirely. I mean, I think it is we were talking about it with the other podcast with Nada, the GP, just about how it's so weird that we have a presumption about we can label a person who might be that we can tell who injects drugs, and that, as I say, you wouldn't. It's just a very weird thing, and I still struggle to work out why we do have such fear, really, as health professionals. And I do agree. You go to countries like Portugal, don't you, where drugs are decriminalised, and it's a very different, world. Have you ever personally experienced stigma? And if so, how did it make you feel?
Yeah. Okay. So yes, I have experienced stigma from the general population quite heavily. I think sometimes with health professionals, they don't mean to stigmatize you. It's just that the language that we use in the rest of the population, the wider community, it's sort of ingrained and you can't see it because everybody is doing it. Yeah, absolutely. I have been treated as if I was stupid, that I was somehow not capable of managing the medication even.
Yeah, no, it is. It's interesting, isn't it? The sort of leapfrog presumptions. And I think it's interesting that you talk about the unconscious bias that I think a lot of people, they don't sometimes maybe, would you think that it's sometimes the way their body movement or that they might pull back? What are the sort of things that you sort of find that would make you feel that people were treating you differently?
So the line of questioning often is not around my illness. It's around what I'm doing outside, like what drugs I'm taking or what else I'm doing. It's not focused on the hepatitis. It's focused from and almost like a parent trying to discipline their child.
No, I sort of know exactly what you mean. I always compare Belinda, to, it's almost a form of voyeurism. I sometimes think that we don't ask when someone says, oh, yeah, I have 2 drinks a day, when you do your social history and you say, do you smoke cigarettes? Yeah. How many? Do you have any alcohol? Oh, yeah, have a couple of beers. But we don't go in and ask what sort of brand or what sort of martini, like, did you have 2 bottles of gin? I mean, it just always, I find it quite fascinating that everyone seems to, exactly like you say, want to, and I wonder again if it's because it's illegal, but I find it very bizarre that we'd never then go and write down in our notes, oh, they had a Bundy last night and then 2 days ago they had this, whereas that's what you find written in the notes, when people have inquired, oh, this is what they use. And it's like, whoa. So yeah, I think that's something that it's probably related to the illegality of it, but it is weird. I can sort of understand where you're coming from, Belinda. Yeah.
And I think often they're coming from a harm reduction, a harm minimisation point of view as well. They're trying to find a road through the information to work out if you're still putting yourself at risk. But they're asking it in a way that makes you go on edge, and you sort of get apprehensive and like, oh, hold on a second, this has turned into an inquisition rather than medical help.
What do you think are the things that if you go to see someone that would make you feel more relaxed or, not feel like there's stigma? What are the things there?
When I'm sitting in a doctor's surgery and for starters, just being addressed politely with a smile is always, hi, how you going? Yes, the doctor, have a seat over there. Then any leaflets or anything saying, like, have you got Hep C? Talk to me. Something like that sort of invites the patient to have a conversation with the doctor about it. That would let me know that doctor is open to hearing what I have to say.
Yeah, no, I think that that certainly does make a huge difference, and we need to, a lot of the primary care practitioners are. It'd be good if they are listening. And I guess has stigma ever stopped you from seeking support from your family and friends?
Absolutely. Yeah, absolutely. Very early on, because I didn't know that there was stigma against this, I told people that I had it and very quickly learned to shut my mouth. And because family members there was just a different reaction about you being in their house. I would be given my own cup and plate, knife and fork that I was to use the whole time I was there. Or if I cut myself, there was this mad stress about it, or the safety of my children or other people coming to your house with their children. So you very quickly learn relationships with people, even though it's not sexually transmittable, really. Disclosing that to a partner has ended relationships instantly. I think there's a thought that you're mentally unstable if you have it, because you're doing an activity that is illegal. Why would you be doing that if there wasn't something unstable about you?
And I think that's where we have in Australia not quite got our head around the fact that some people can inject drugs and do it, safely, do it just no different to someone going to the pub. There's a small percentage of people who, yes, it becomes a problem and, they can get addicted and there's other health problems from it, but it's no different to people who inject drugs. And that's where I agree totally with your whole discussion about the criminality. And that's where I think sometimes until we address that, we're not going to really address a lot of this stigma in our current society, because there should be just as much stigma. Alcohol causes far more problems, but we don't have it. We almost celebrate it in Australia. So it's something we still need to tackle very much as a society, isn't it? Because it's not only about the hepatitis C, is it? It's like that's one small little package of the stigma. Yes, we can help and cure this disease, and we need everyone to know that it's so easily treated. It's not the interferon days, but that's only one more part of the stigma, really, isn't it, too?
And also you can catch it from, I remember, lots of people back when I was younger, piercings and tattoos and stuff that weren't done in maybe overseas in Bali, or they were done in Australia by friends before we had understanding of how to sterilize for hepatitis C. So you don't even have to have been a drug user to be hit with the stigma from it.
Yes, no, that's exactly, yeah.
I think also having had agencies like family and community services in my life, you will get and they have access to your medical records. So you get and medical records are put down in shorthand. So when someone rereads those, there can be a lot of assumptions made about the words that are used and misinterpreted. When you have children, or you're on parole, or anything like that, where you feel that something is at threat, your liberty or your children are at risk, you learn you only need to be tainted once with that horrible stigma that you just shut up.
Have you got a few tips that you could give to doctors to address, to help them address stigma when caring for people with hepatitis C?
Yeah, understand that they're probably coming in with trepidation and fearfulness about how you're going to react. So be clear about the fact that you are welcoming and open about talking about it. And maybe not that time you see the doctor, but next time, remind them, can we have a chat about this? And keep going, because they might be in a hurry that day, but the next time you see them, they might not be, or they've learned some more information. So keep giving the information to people and arming them with information, the correct information, and don't be shy to encourage them to seek treatment for this very treatable illness.
Thank you very much, Belinda, for being here today and sharing your journey and lived experience of someone who's experienced stigma living with hepatitis C. I think as health professionals, the other amazing thing we can do to assist in reducing the long-term stigma for people who have lived with hepatitis C is to ensure that once they've been treated and cured, that we make sure we take in general practice that hepatitis C is no longer an active problem, and we put it into non-active and treated and cured, and also empower our patients that when they go, if they may be at hospital, that they actually say, if they ever give a history of hepatitis C, that I was treated and cured, so that we can help long-term reduce the stigma that still exists, unfortunately, about chronic hepatitis C. Thank you very much.
Thank you for listening to this MD Briefcase podcast. If you'd like to explore our full range of podcasts, videos, and accredited programs, please visit mdbriefcase.com.au.